Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I am here with board-certified dentist and oral surgeon, Dr. Amy Thompson, or Toothy Thompson, as she's known online on her socials. I am talking to her about home dental care that actually gets done. I'm on this kick right now about really thinking deeply about how to advise pet owners to increase the lifespan and quality of life of their pets. Like, if I could make a program that would give you the highest chance possible of having your dog or cat live to age 25, what program would that be? And obviously, it's going to have a nutrition component. It's going to have sort of an orthopedic wellness, fitness component. It's going to have a dental health component. And so that's what I'm going to talk to Amy about is, how do I communicate this to pet owners? What would you put into a program like this? And again, the emphasis here is not on what's ideal. What can we actually get pet owners to do? And she has strong thoughts. And so that's what we talk about today. It is a good episode. It's motivating. It makes me want to jump back in there and work with my dog. And I think I'm probably going to do that. I think I may even film it and see how it goes. So anyway, that's kind of where my head's at. This is a great, fun episode. It'll inspire you, get you talking about dentistry again. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Amy Thompson. Thanks for being here.
Hi, thanks so much for having me back.
I love having you back. You are such a joy to talk to. You just have this infectious energy. It's why you are growing such a nice little presence on social media. Your passion and enthusiasm for dentistry just comes through. You're one of those people who has the ability to, I don't want to say infect other people with your enthusiasm. Like, I feel excited and sort of inspired about dentistry and what's possible after I talk to you. And I really think it's a gift that you have. And so I like to keep that medicine fun and upbeat, and I like to get sort of re-energized. And I think that one of the gifts that you have is that you are able to sort of instill this energy into other people. And so anyway, I appreciate that you make time to come and talk with us.
Oh my gosh, you're so sweet. Thank you so much. That means so much. I love teeth. I'm excited about it, and I'm excited to see our colleagues get excited about it.
Well, I told you this when we first started chatting before I sort of hit record on the podcast here, but I'll say it again. One of the things I really admire about you, I think is so great about you and your story, is that you were a general practitioner with not a particularly great level of interest in dentistry. And then there, as a doctor, this wasn't picked up in vet school, you sort of started to fall in love with this piece of vet medicine. And you were able to go back into a residency and really make this your life. And there's so many vets and technicians that I talk to or see who at some point come to feel kind of stuck in basic general practice. And I love to see people like you and try to hold up people like you who did general practice, liked it just fine, but then decided to make it into something different. You found something that you loved and decided to do more of that. And you were really able to kind of bend the profession to your will and kind of make for yourself what you wanted to have. And so I just think that's an important part of your background as we start to talk about this, because the other thing I always like to talk about with you really is communication to pet owners. And the fact that when you're a specialist, you see a certain type of pet owner, and maybe that's not what you see as a general practitioner, but you have that experience talking to GP clients. And so I really think that you're a uniquely wonderful resource here. So anyway, that's kind of why I sort of reached out to you. I've got this wild idea, Amy, and I'm really getting into this idea of longevity in pets. I really am starting to think about, what could I do if I was a pet owner to increase the likelihood of my dog living to be 20 or 25 or 30. Mm-hmm. And I think about this because, I'm just being transparent, I'm not getting younger myself, and my parents are getting older and things like that. And so I've been doing some reading on human longevity and things that are helpful in helping people have not just quality of life, but quantity of life. And I see so many parallels in pets. And as I'm thinking about this, and I say, I would like to advise pet owners as their veterinarian, I would like to be able to guide them or at least support them in the idea, let's make your dog live 20 years. And so dental health has got to be a part of that. Like, we know that weight control and dental health and behavior are probably the three big things that really impact longevity for pets. I think that's probably the things that are most in our control. And so what I wanted to talk with you about today is what's really feasible for pet owners as far as home dental care, because I'm in the exam room and I'm talking to them, and it always comes up when you say your pet needs to get their teeth cleaned, and they go, oh, well, what could I do at home? And that's a whole different thing.
Yes.
But it's a whole different thing. But what if I empower them to do better at home? What can we talk to them about as far as home health care that they could start at a young age to really try to increase their pets' quality of life and quantity of life? And so let me sort of pause here for a second and sort of hand this over to you and say, Amy, when we talk about home dental care, how optimistic are you here? And what is sort of your approach to this? Because I know that you know the absolute best practices, but also I'm sort of reaching out to you because of the pragmatism that you have about what will they actually do? And so I don't want to give them a presentation that they just politely smile through going, I'm not going to do any of this. So help me sort of get started with that approach.
Yeah, for sure. And I'm so eager to talk about this. And I think it's funny and I enjoy it. It was very honest when you reached out, like, let's talk about dental home care that owners will actually do. And the subtext to that is not toothbrushing. And I think I wrote back, like, totally pleased to, but we will talk about toothbrushing.
But we're going to talk about toothbrushing. Okay.
We're going to talk about toothbrushing. And I think it can go back to that conversation of Oliver here, we need, we've got gingivitis and concerned, we need to do a cleaning. And, we start talking about that and the expense of that. And that's something we need to do, but what can we do to preserve that health or maintain that health as long as possible? And I mean, sometimes just being frank and honest with owners of, listen, toothbrushing, there's nothing better.
Yeah.
If there was anything better, we'd be doing it for our health. I just broach that and just say, I know you are thinking this isn't going to happen. Or a lot of owners are like, yeah, I tried. He hates it. It doesn't go well. I'm like, great. I'm so glad you tried. May I ask what didn't work? And I would say 99 times out of 100, the owners will say, oh, they're chewing on the toothbrush and they're like spitting it out of their mouth. And I'm like, okay, tip number 1, you're going to like. So my tip number 1 is that don't brush your pet's teeth like you brush your own teeth. And I think that that's something really important to acknowledge. We're all brushing our teeth every day. We're doing a pretty good job at it. So naturally, if we're just being told, okay, brush your dog's teeth, we're going to do it the same way we do our own, which makes sense. I will say, listen, brushing every surface of your pet's teeth, ideal, gold star. The reality of that happening daily is about 0.1% chance because they don't want anything in their mouth. They're like, this is weird. We don't want it in there. Their tongue is being hit the roof of their mouth. It's not really that pleasant. We do it because we know that we need to, but they don't know the benefit of it. So I actually say, I would love you to brush all the surfaces of their teeth. And that is what I would call like super advanced gold standard brushing. But let's just talk about being consistent. Like with anything in life, learning a language, training for a marathon, it's more about consistency than what you're actually doing. And so I say, I'm right-handed, so take your left hand, make an L, and just wrap it around their little muzzle. Just soft, like no firm, we're not white knuckling here. Okay. Just enough to encourage them to keep their teeth clenched. And then I take my toothbrush, or I'll start with a finger, and then I just stick it in their cheek pouch so they can keep their mouth closed, and I just rub the outside surfaces of their teeth. Okay. And we'll do that in the exam room. I'll get in there with a finger, I won't use a toothbrush, and I'll just say like 4 to 5 swipes back and forth. And most dogs, and cats for that matter, that are just like, hell no, they will tolerate pretty okay. And then the owners have this moment of like, oh, well, that wasn't terrible. And I'm like, this is the goal. The goal is to get the brushing back and forth. But if you can just start touching a tooth and then giving them a treat, which is tip number 2, cats don't get cavities. Less than 5% of dogs get cavities. I've treated 2 dogs with cavities in the last year. Very rare. Okay. So unlike you and I, where we're going to eat and then brush, you can actually brush and then feed them. And I don't know about you, Andy, but I'm very food motivated. Yeah, so if I'm going to get my meal or a tasty snack afterwards, after repetitions, like 4, 5, 20 repetitions, our pets are smart. They know where the treat bowl is. They know when treat time comes. As long as we keep it positive, keep it short, keep it positive, they tend to be like, is it really that bad? I get the treat afterwards. So I really like to talk to owners about those being my two main tips is focus on the outside, make it positive.
Yeah.
I mean, some pets, very few, are not food motivated, but I've had like a cat owner use the cat loves being brushed. Okay, just touch a little tooth, brush, touch a little, and work up to that.
I like it. That's awesome. It's funny. It matches up with what I was just thinking today, because I was out walking Skipper, and he is super treat motivated. It's just really funny. It took me an embarrassingly long time to figure out how treat motivated he was, and that he's a wonderfully compliant dog, as long as I have treats in my pocket. And it doesn't have to be anything extreme for him.
Right.
Like the little crunchy, low calorie milk bones, he goes nuts for that stuff. I'm like, okay, this is not a big lift, but boy, I fought a lot of battles. I didn't need to if I had just gone heavier on the treats at the very beginning.
Yeah. And it's, we'll show them in the exam room, like, this is ultimately what I want to get to, but like, you're not going to start, you're not going to just put on the shoes and run the half marathon, right? You're going to start by like walking around the block, and then maybe jogging for 1 minute, walking, so we're going to have to build, but the biggest key is consistency. So keeping it relatively positive. If that means just touching a tooth and they get a cookie, great, because we're building on that. Yeah. This isn't so bad. This is a positive. I think I've heard before it takes 21 days to build a habit. So like we need to commit some repetitions here, put some reps in, but it's amazing. Like my technician's cat will come and wait to have his teeth brushed. Yeah. When it gets to be up, because they know it's dinner time, and like this is the routine. We do the toothbrushing, and then we get our bowl of food. Yeah. And I've had pets in the past that we did it at bedtime. And so anytime after 8 p.m. you go in the bathroom, the dog's following you. They're like, okay, I'm ready.
Yeah.
We can really use that Pavlovian dogs, really, that classical conditioning to our advantage.
I like this a lot. I can honestly see this working into my routine. Hey guys, I just want to jump in real quick and tell you about something free that I have for you. It's a gift from me and from my team over at the Uncharted Veterinary Conference. It is our superhero game. Guys, you know that I am all about bringing fun into practices. I like to make people smile. I like to make people laugh. I like to bring teams together. And this is a game that we came up with that we have used at some Uncharted conferences before that is absolutely just about having fun. Have you ever done an escape room and had them come in and introduce you and tell you about the adventure that you're on and have your team kind of work together? You can kind of get the feel of this, the vibe of it. It's a little game. It's got a couple different pieces to it. You can pick and choose the ones that you want. This is all about people coming together and identifying what their superpowers in the practice are and having other people say to them, this is what I think your superpowers are. And it is really fun. It is really funny. It is a great icebreaker for your staff meetings. It is something that you can come back to again and again and have your superhero teams assemble and things like that. I don't want to say too much about it because you really just gotta see it, and I don't want to spoil the fun, but it is a great thing for you to do with your team. It's totally free. It's our gift to you. Super fun. Just laugh, have a good time, watch your team grin and come together. I hope you'll check it out. I hope you'll really enjoy it. We're very proud of it. unchartedvet.com/assemble for your free copy. One of the things you said that I really loved is just the way you can turn a phrase when you say, if there was something better than brushing teeth, then we would do it ourselves. And I was like, that's a really good phrase. Amy, how do you give the value proposition before we're talking about dental disease or periodontal disease? You know what I mean? So what I'm saying is just as an example, let's say that I saw a 16-week-old puppy/kitten yesterday, and they came in, everybody's happy, they're playful, they still have their puppy and kitten teeth. How do I start talking at that point so that the pet owners hear me, right? It's much easier to wait until they have periodontal disease and say, we don't want to have to clean these teeth as super often. Let's get them clean, and then you can start doing this so that we can hold this off. And they've experienced some pain. They've kind of seen what intervention looks like. And so I feel like I feel like I have more leverage to have that conversation, but that's not ideal. Really, I would love to get them started when there's not a fleck of tartar on any of the teeth.
Absolutely.
And you know what I mean? And not wait until we've had this sort of like car crash and then we're like, let's not do that again. So how do you have any good ways or phrases to sort of try to sell them on the value of making this commitment when there's no periodontal disease, there's no sign of disease at all?
Yeah, no, that's great. And obviously, maybe not obviously, but the earlier we're teaching our pets, the better, because as babies, they don't really know, quote unquote, yet what is totally normal. So that whole, you can't teach an old dog a new trick, I don't agree with. If they're motivated, we can teach them anything. But certainly starting younger is better. Prevention or maintenance is definitely better than treatment. I mean, it's been many, many years, but back in the day when I was in general practice, and it's hard to fit everything in a puppy visit, but I would just say, everything's looking good. And I would at least make sure there was a conversation like, okay, we've got baby teeth. We're starting normally around 16 weeks. We're starting to see some adult teeth come in. And so at least have the conversation of like, I was told many, many years ago, talk through your physical exam. Because if you're just doing your physical exam, owners aren't realizing how much we're picking, like we're looking in the mouth, we're checking the gums, we're checking the teeth, the occlusion, things like that. And so I talk through it, be like, really happy, occlusion's normal. Like we don't need to address anything with the teeth now, which is wonderful. Certainly, just mentioning, I really am about preventative care. I really want to keep Fluffy as healthy as we can moving forward. And so the number one and number two disease that we're going to deal with is going to be periodontal disease and obesity. So let's really talk about things. So like with cats, meal feeding, even dogs meal feeding, so then we can better assess what they're eating, how much they're eating, if they need to go on a diet. It's something we can do. If you end up having more than one pet in the house, we can manage that. So we'd talk about meal feeding. And then the other thing I would say is now is the time to get them used to toothbrushing, because it's going to take a while for you both to get proficient at it, for them to accept it, for you to remember every day. And so like the baby teeth are just like our trainers, right? Like they are going to exfoliate, most of them. Some of them will be persistent. We'll address those at spay and neuter, but most of them are going to fall out. So if it takes us a couple months to get it figured out, then once the adult teeth come in, now we're primed and ready. And I will always say, toothbrushing is not going to remove the need for regular professional cleaning. Like we brush our teeth multiple times a day. We still go to the dentist, but shifting away from like avoiding professional care and shifting that to keeping them healthy longer, less extractions, which means less surgical time, which means less anesthesia time, less overall cost, less risk, not needing to heal. Like I would absolutely, like my heaven is all pets get their teeth brushed, they get professional cleanings once a year, and we're not dealing with extractions. So then the day after they have their teeth cleaned, we're back to brushing instead of taking a break and allowing that plaque and calculus to build up. And then with my really tiny dogs, I'll say, like unfortunately, I'd love to see a shift. I hope in my career I'll see a shift, but because home care hasn't been a huge part of veterinary medicine when it comes to dental home care, because there's just so many things to deal with. In toothbrushing, everyone's like, they hate it, they don't like it, we'll buy this treat or whatever. But like 90% of toy breed dogs will have periodontitis by the time they're 1 year old, which is crazy. And a lot of owners are like, my pet's only 5, how is this possible? And I'm like, they're only 5. I mean, they're doing well. They're beyond the curve, because at a year, sometimes I'll see puppies come in at 10 months to have persistent deciduous teeth taken out, and they've already got gingivitis. They've got enough calculus that they've got gingivitis. So sometimes just sharing those facts of it's not going to remove the need for professional care, but it's going to decrease the severity of disease, which is going to then decrease, the overall anesthesia time, the number of visits, the cost is a big one. I think we have to be transparent. That is a big part about professional dental care, because it does require anesthesia to be done appropriately. I think just trying to focus on, okay, we're all the healthiest, generally speaking, when we're younger. And then while age isn't a disease, as we age, we're more likely to develop disease, and periodontal diseases, unfortunately, number one. But it is something we can fight with a toothbrush. And it is something, if caught soon enough, we can actually reverse, which I think we've talked about. I really nerd out about that because, once you've got a disease, we're managing it. But if we're seeing these patients when we've got gingivitis, but no ligament loss, no bone loss, a thorough deep cleaning actually will reverse that inflammation and reset to zero, to no disease, which really lights me on fire, because I think that's so cool. Like normally once we've got a disease, we're just managing it. So if we can really work together, I say like what I'm going to do is only 1 day. 364 is on you. And so I just really want to be a team and keep this mouth as healthy as possible, because like you said at the intro, like our oral health is really the gateway to our entire body. And that's a lot of bacteria, like a ton of bacteria that sits in that plaque and calculus.
Yeah.
And then once we get inflammation in the gums, we can get that in the bloodstream. And so, a healthy mouth is a healthy pet.
Yeah. Oh, definitely. What do you like? Do you like a toothbrush? Do you like gauze pads? Do you like the finger brush? Are you neutral? If I'm starting with a dog or a cat from the very beginning, am I trying to get them to a soft bristle toothbrush, or are you okay with the finger, gauze pads, things like that for the long term?
Yeah. I'm a big fan of a toothbrush. It needs to be soft bristle. Basically all like dog, cat toothbrushes are going to generally be soft bristle. I actually still have, maybe it's weird, I still have little Raisin's Nose pediatric toothbrush.
Okay.
So pediatric toothbrushes are great for really small dogs and cats because we want to disrupt that biofilm. So my worry is if we're using something that's not a little bit abrasive,
Okay.
like we don't want it super abrasive, but we need something to break up that film. And then, so my worry is sometimes if you can get those really fine, I think they sell them as like cat toothbrushes, but I use them for small dogs as well. But like it's smaller, like I have small hands, but it's narrower than my pinky. And so you can really, and it's got a long handle, so you can really get back. So I personally prefer getting to a toothbrush. Now that may start with like a finger and then a wipe and that kind of thing. But honestly, like any sort of mechanical debridement of that biofilm is going to be ideal. But my goal is to get to a toothbrush.
Okay, that makes sense. Are you worried if you start to introduce alternatives to toothbrush or supplemental tools, right? When we start talking about chews and things, are you seeing this as a good thing to introduce in the conversation, or are you worried that you're giving them alternatives to the toothbrush? For example, if I say to you, hey, pet owner, I've got this thing that I want you to do, and you go, well, I'm not going to do it. And I say, here's a thing that's significantly easier that I just let them completely off the hook for the first thing. And I don't know, do you have that thought? Are you okay to talk about these other things? You know they're going to bring it up. They're going to say, what else? Or what do you think about these rinses? Or I do antlers. Do you like antlers? They're going to say those things. You know they're going to say them,
Yes.
I heard I got antlers yesterday. Yesterday I got antlers.
Oh my gosh. It kills me. It kills me, the antlers. Yeah. So I think that unfortunately, and again, all I do is teeth, right? So like I have 30-minute consults to talk about treatment, and I sneak home care in, but we also do a lot more home care discussion. I have complimentary recheck visits. One, because I want to make sure they're healing well. I want to hear how they're doing, and then really delve into home care. Like once I've done this treatment, okay, but like what are we doing? So I would say I definitely have more time than general practitioners. However, I do think that it's, well, I'm not going to brush. And it's just sort of like, okay, but we haven't taught them how to do it. Like we haven't given them the steps. And so they've tried. Most owners, and some will say like, I'm too busy or it's just not going to work. And I'm like, okay, but most have tried because they hear what you're saying and like, we're going to try. And then they do it quote unquote the wrong way. And then it doesn't work. And then they stop. So I do think letting them off the hook, I mean, sometimes it's letting you off the hook. You have like 8 other things to talk about. But I do think if we can, as a team, really be focused on what is the best. And sometimes, like I said, there's nothing better than toothbrushing. The other thing about toothbrushing is there's no added calories. Obesity is a big problem. We don't have to worry about allergic dogs or cats or things like that. And the cost is very minimal, right? Some of these chews can really get up in cost. So not only is it the gold standard for health-wise, but there's a lot of positives to that. So I think mentioning that, and then also I'm game to talk about other things because we're not perfect. Have I missed days of toothbrushing? Yes. And like adding other things on can be really helpful. If you're traveling and whoever's pet sitting can't, there's lots of reasons. So I would say that I like to base my home care around daily toothbrushing, but I'm all for other things. However, we have to be very careful about what we expect out of those. So a rinse is not going to mechanically debride the plaque.
Right.
It just isn't, right? It's not mechanical. So the rinse may decrease minerals calcifying onto the plaque to make calculus, but it's not getting rid of the plaque. So if you have plaque, you'll always have calculus. If you're getting rid of plaque, you can't get calculus.
Gotcha.
And then like with chews, okay, those are mechanical, but those are only helpful for teeth used to chew. So they're canine teeth, they don't chew with. So like we're not getting a benefit from the chew on those teeth. So I think being very honest and acknowledging, and I will kind of spell that out of what are the pros and cons, because I see a lot of stuff being like as good as toothbrushing. And then you read in the font, it's like as good as brushing twice a week, which is because calculus develops within 24 hours. So if you're doing it every 3 days, you've got 2 days worth of calculus that you can't brush off. So you're behind the 8 ball. So unfortunately, pet care is a huge market. It's a huge market, right? It's overwhelming, even for me, going into the pet store and seeing all the things that are like good for their teeth. And then you see something like antlers, which is like actually terrible. It's going to cause teeth to break just based on physics and anatomy alone. Yeah. So it's hard for pet owners. So I do think when and if we can find the space and the time in our appointments, whether it's us directly or other veterinary professionals on our team, to at least acknowledge, because they're going to go find those things and be like, yeah, they said toothbrushing, but I can't do it. And this says as good as toothbrushing. So like, I'm going to just swap that out. So I do think just acknowledging that, like, I'm all for rinses and diets and chews and things like that. They're not going to get to the same point as toothbrushing. So I think if we can use those things to supplement, I'm all for it.
Yeah. Potentially stupid question. When you
stupid.
When you see dogs that they have dental calculus builds up and gingivitis on their canines, but then you don't see a lot of calculus or gingivitis on their premolars, I just kind of assume that was a weird thing or a part of their mouth anatomy, something like that. Are those dogs potentially that are doing some like dental chews or things like that, and maybe that's why they're not getting this buildup on premolars, but we're seeing it on their canines? I guess I've seen a lot of those dogs where I go, well, I don't really see it on the premolars, but definitely on the canines. Is that an idea that might bear weight, or is it like, no, Andy, probably not. That's probably just dumb luck.
No, absolutely. I think that's the case. Like I've had many cases where, we look at the front of the mouth and the incisors and canines are not looking so hot. And then I pull back and I'm like, looking pretty good back here.
Yeah.
Looking pretty good, because generally our calculus pattern in our canines and feline patients is going to be on the maxillary fourth premolar, because our salivary ducts empty there. And so they're getting the most saliva, the most minerals in those saliva. So like all the teeth are pretty evenly going to get plaque buildup. And I will tell owners, it's like when you wake up and you have that like weird, slimy, fuzzy sweater feeling. Like we all get that. Like we get it, our pets get it. And then if we don't brush that off, it's actually the minerals in our own saliva that mineralize. And so we should see naturally more calculus on these maxillary fourth premolars because they're the first one to be bathed. And so when I really dive into it and I'm talking more to owners, I do see, and sometimes it's not super obvious, but like I had a case last week where I was like, things look real good back here, like really good in a small breed dog, which always, I'm like, did you get an anesthesia-free cleaning? Is there something like that? That's one of the first things when I don't see a lot of calculus in these little guys. But no, this little guy was on a dental diet, got dental chews, but toothbrushing they were really struggling with. And then we worked through like how we can get on top of that. And so for now, because we do have some gingivitis, I say like, let's not get in there hardcore in case we cause a little bit of irritation and then it's painful and then we lose traction. So what they're doing between our appointment and coming in for a cohat is they're just going to focus on like touching teeth, lifting lips, just getting more comfortable with the mouth being handled. But yeah, I've definitely seen that in some patients that are really doing the dental diets and the chews. And then we're seeing more periodontitis up front where those chews aren't helping because those teeth aren't used to chew.
Well, that makes sense. It always stands out to me. I see them fairly regularly. I mean, not nearly as often as, just funk everywhere. But I do see them sometimes where you do that first look and you see the incisors and the canines and you go, ooh. And you look in the back and you go, oh, well, that's much better than I thought it would be. So anyway, Amy, you are amazing. Thank you for being here. Where do you like to send people if they're looking for resources? I know that you are actually making a lot of educational resources, always for vet professionals, but also for pet owners. Tell me about that. Tell me where people can find it.
Everything for me started a few years ago on Instagram. And so I like to do kind of short, fun, try and be entertaining. But if you're looking for something got some more grit to it, the meat and potatoes of things, as they say. I just relaunched my website, which I'm really excited about. It's a work in progress, but we have both a pet parent side and a veterinary professional side. And so we're working on keeping them like short and sweet, but like one-page handouts of things like malocclusions, fractured teeth, Anesthesia-free cleanings, that's been a big one. The reason we need anesthesia to appropriately clean and manage your pet's oral health. What is a cohat? So just trying to like support all of you. And I've asked many times on social media what you all are looking for, because I know it's a lot in that exam room. And so you're touching on these points, and then, you don't get the same amount of time to talk to them as I do. So just really trying to have something like tangible that you can either kind of print off and give to an owner, or you can send them to that PDF document to get a little bit more information. We've got some pictures in there. I'm a very visual learner, so some pictures in there to just sort of help round out or supplement the information that you're giving your pet parents.
Cool. Thank you so much. Thanks for being here, Amy. Guys, thanks for tuning in and listening. Take care of yourselves, everybody. We'll talk to you later.
Bye.
And that's it. That's what I got for you. Thanks for being here. Thanks to Amy for being here. Gang, if you like this episode, send it to a friend. Share it with your staff. Let's get more people talking about dentistry in the exam room. I think it's just an important thing to do. Again, it's about increasing the quality and the quantity of the pets' lives that we serve. I think this is an important part of it. Gang, take care of yourselves. Be well. I'll talk to you later on.